Yeah, unfortunately, humans vary, and there are surgeons I'd go to, and my family would go to, and I'm sorry to say there are many they wouldn't go to. And to be a gifted surgeon is actually quite a complex thing. It's not just about the hands. I've seen surgeons who are gifted with their hands make operations look easy, but their judgment was poor. They'd operate far too often on patients who didn't need surgery, and they clearly didn't understand that many conditions can be treated very well with physiotherapy. So I think that the true gifted surgeon is an all-rounder. They are committed to that patient. They don't give up. They take the rough with the smooth, because there's no surgeon who doesn't get complications. But the real measure of the person is how they deal with adversity. It's not just about them keeping the patient. If they know that someone else is better, a good surgeon will hand that patient on for a second opinion. And you have to admire that, because it takes guts to do it. They need to be committed to never-ending learning and self-improvement. They need to be able to judge when a patient needs an operation or not. They need to choose the right patient for the right operation. They need to do that operation well, so they need to understand the anatomy, the biomechanics, the implications of the surgical intervention, and they need to be able to execute that operation perfectly first time. There's not much room for manoeuvre. Generally, the human body is quite tolerant, and there is an element of wriggle room for a surgeon, but obviously the higher demand of the patient, and particularly with athletes, that wriggle room gets smaller and smaller. And then they need to understand the commitment to proper post-operative care. We cannot act like technicians, and we do see endless disasters, patients coming back from the Alps who were persuaded to have surgery rather unnecessarily, I might suggest. There are many things that can wait. In fact, the vast majority of orthopedic conditions should wait until the knee is quiet and ready for an operation, even if it's one that needs to be done within a matter of days or weeks. It doesn't have to be done on day 1 or 2. And so it's a real package. And then the really great surgeons, the really great ones, have charisma.